As we navigate the ongoing turmoil of the COVID-19 pandemic, a question lingers in everyone's mind. What happened to the global health crisis? In a significant recent development, the World Health Organization's Director General conveyed a message of hope, stating that the end of the pandemic might be on the horizon. This optimism is fueled by the recent decline in the weekly reported deaths worldwide, hitting its lowest since March 2020. As of today, the global case count stands at over 131 million, with the death toll exceeding 2.8 million. Despite these staggering numbers, there's a glimmer of hope as more than 590 million doses of vaccines have been administered globally. To chart a clear path forward, the organization released 6 comprehensive policy briefs recommending crucial steps for governments. These include increasing investment in public health infrastructure, focusing on early detection systems, and enhancing health service delivery to make it affordable and accessible for all. Moreover, these briefs highlight the need for strategies not just to tackle COVID-19 but also to prepare for potential future pandemics. They advocate for the development of robust systems and a competent workforce, along with international collaboration for disease surveillance and response. It is further emphasized to promote research and development initiatives to better equip ourselves for future health emergencies. These policy briefs offer profound implications. They signal a shift from a reactive approach to a proactive one, aiming to anticipate and prevent future health crises instead of merely responding to them. They call for global solidarity and cooperation in addressing health emergencies and stress the importance of equitable access to health services. They are more than just a set of instructions, they're a roadmap for a healthier, safer future. Nevertheless, it's imperative to outline that the formal case counts declared have been heavily undervalued. Notwithstanding, recent data indicates that both international and U.S. trends show a steady decline in cases. The global weekly case numbers have plummeted by 28% and have been gradually dipping in the U.S. for the preceding 2 months. This decrease has been reciprocated in the fresh daily cases count too. Worldwide, the mean number of new cases has fallen to under 500,000 per day for the first occasion since the pandemic's onset. In the U.S., new daily cases have also observed a major drop, sinking below 50,000 for the first time in over a year. When examining fatalities, a decrease of 22% was reported globally, with reductions noted in 5 HU regions and an increase in the African region. The United States reported the maximum number of weekly deaths, followed by Japan, Russia, Brazil, and the Philippines. Globally, there have been more than 6.4 million reported deaths until September 11. Furthermore, the overall global reproduction number, which refers to the average number of secondary cases produced by a single infected person, has declined to less than 1. This significant statistic informs us that on average, each infected person is transmitting the virus to fewer than 1 person. This is a noteworthy milestone on the path to ending the pandemic. In the U.S., the reproduction number is also under 1 and indeed has been decreasing for the preceding 6 weeks. This suggests that the rate of transmission within the U.S. is continually decreasing. Though these figures exhibit a positive trend, it's essential to bear in mind that they are based on reported cases, and the actual number of cases and fatalities may be significantly higher. Around 2/3 of the world's population, including the United States, have received at least 1 dose of the COVID-19 vaccine. However, the scenario is vastly dissimilar in lower-income countries, where vaccination rates fall behind. These countries face manifold challenges such as insufficient resources, limited vaccine availability, and deficient healthcare infrastructure. This discrepancy in immunization rates not only puts these nations at a greater risk of COVID-19, but also escalates the threat of the emergence of new variants. Even though the U.S. Centers for Disease Control and Prevention predicts stable hospitalization and death rates in the upcoming month, the concerning situation in these lower-income countries casts a pall over these prognostications. A cloud of concern hovers amidst prevailing optimism, underscored by a World Health Organization representative declaring that the end of the COVID-19 pandemic is not yet within sight. What incites this caution are several key factors that keep fueling the pandemic's longevity. The foremost among these is a notable rise in the number of cases worldwide, a stark reminder of the virus's tenacity. Taking us further away from the finish line is the Omicron variant, notorious for its heightened transmissibility, escalating the global concern. Furthermore, the rollback of public health measures in various regions of the globe poses yet another substantial risk, further intensifying the situation. The Centers for Disease Control and Prevention, CDC, has been tirelessly monitoring the risk factors of various countries, delivering vital data to travelers across the globe. The CDC formulates these risk levels based on the count of active COVID-19 cases per 100,000 inhabitants over the last 28 days. This system sorts countries into one of four groups: low, moderate, high, and very high risk, with level 3 signifying the peak risk level. In the last fortnight, no new countries have been added to the CDC's high-risk category, but there have been significant adjustments. Kenya, for instance, has enhanced its position, descending to the low-risk group. On the flip side, Azerbaijan witnessed a sharp rise in its risk level, moving up to the high-risk group. These risk levels furnish a pivotal snapshot for travelers, influencing their decisions on proceeding with their travel plans. They also dictate the precautionary steps required for their journey. With over half of the roughly 235 locations under the CDC's watch falling into the high-risk group, exercising caution is essential. The crucial element for safe travel continues to be vaccination, which greatly decreases the risk of critical illness. The CDC fervently suggests travelers to get COVID-19 testing done prior to their return flights to the U.S. It's crucial to note that no travel should take place if a person is feeling unwell or exhibiting symptoms. These measures not only safeguard the traveler, but also contribute to the protection of the wider community in the ongoing global endeavor to combat this pandemic. To wrap up, the global fight against the COVID-19 pandemic continues, marked by a mix of optimism and vigilance. A decreasing pattern in cases and deaths is evident on an international scale, yet the situation remains dynamic and difficult to predict. In the United States specifically, COVID-19 statistics reveal a similar trend, with an added emphasis on the progress and challenges of the vaccination rollout. The speed of vaccination programs is accelerating, but not without obstacles, particularly in economically disadvantaged countries. This journey to the end of the pandemic is a continuous process that requires everyone's involvement. Each one of us plays a crucial role in reaching our collective aim, the cessation of the pandemic.